Hi everybody, and welcome back to another RCGP Masterclass, this time focusing on at-scale working in general practice. My name's Anthony, I'm an ST3 GP trainee, chair of the RCGP's Associate in Training community, and your host today. We've created this series to help answer some of those frequently asked questions that many of us build up throughout our training. We're going to be hearing from a range of GPs, sharing their experiences and top tips across a wide range of subject areas. Today, we're delighted to be joined by Professor Mike Holmes. Mike is a GP partner at the Haxby Group, which is an at-scale GP provider in York and Hull. He's also the Vice Chair for Membership and International at the RCGP and an honorary professor at York University. Hi, Mike. Thanks for joining us.
Hi, Anthony. Yeah, really good to be with you.
So this video is all about at-scale working, and you've got kind of first-hand experience of that. A lot of people, when they think of at-scale working, it might mean different things to different people. What would you say that at-scale working means in general practice?
I think that's a really good question. I think, my own practice has grown. I joined almost 20 years ago, and it was probably at scale then. It was 20,000 patients back in the early 2000s. But since then, we have grown, and we've grown for a very good reason. We've tried to grow to meet patients' needs and actually to tackle health inequalities. We started in York, which is not a deprived area, but as opportunity arose, we moved into Hull, which is a deprived area, or has pockets of deprivation. And when we went there, the public health outcomes really, they sang to us. They sang to our value set, and so we were able to grow in a way that was aligned to our values and hopefully beneficial for the population. So we've gone from 20,000, and then we moved to Hull, and 10 years later, we look after 60,000 patients across both cities, about 30,000 in each. And actually now we're starting to have conversations with a practice in Scarborough, which is just up the coast. It's about an hour up the coast from Hull, another deprived coastal under-doctored town. And so actually in the not too distant future, we may be working at about 100,000 across 3 sites. But that stable base has allowed us to grow and address and work in areas where there are significant challenges, both in terms of employing doctors and health inequalities. And that's felt really good. So our scale has reflected our ambition to have a real impact on the ground, I think.
And you've kind of touched on probably a lot of the key benefits that you see from at-scale working, such as being able to address those kind of wider population health needs for the communities that you serve. Are there any other kind of key benefits that you've recognised from working at scale?
Yeah, I think so. I think what it's enabled us to do is well, you achieve economies of scale, and so it allows you to develop different aspects of the practice. We've developed a very strong education and training arm. That's been required as we've gone into under-doctored areas. We've diversified into pharmacy, and that's helped us work with a team of initially pharmacists, but increasingly multi-professional team, and invest in that multi-professional team and allow it to grow. And ultimately what that does is has an impact on the workload of GPs. The scale has enabled us to increase the length of consultations, perhaps reduce the workload, perhaps make the work-life balance a little bit better. It's freed GP time to be involved in clinical leadership. So one of the real benefits for us is having a combination of clinical and non-clinical leadership driving the growth and performance of the practice. And that has felt really positive. And I think one of the criticisms I often hear about at scale is, oh, it's really impersonal and you lose continuity. Well, I'd probably challenge that in that, across the 3 places we work in, there's 13 actual surgeries, and they all have their clinical teams, and we don't move people around. So you still get that local feel, you get that local continuity, and that's really important. But what we get is that infrastructure. The scale gives you the infrastructure to look after the organization. So as a partner, I'm not perhaps doing some of the hands-on administrative, managerial work that perhaps you would have to do in a small partnership. So, we have our HR teams and our finance teams and our data teams and our business intelligence teams. And that helps us use data and information to drive quality improvement at the coalface. And so for me, that's one of the two biggest advantages, well, three actually: being able to pursue your values, being able to free up time for clinical leadership, and be able to concentrate on clinical work in local communities.
And you kind of touched on, as over time things have grown, you've obviously had more people kind of join together, and I'm guessing the size of the partnership itself has grown. In terms of kind of the governance of an organization at this size, how do decisions get made? How many partners, kind of like, what's the kind of work for, like, what workload of the partners within that?
Yeah, so that's absolutely critical, I think, and everybody has to be clear on how decisions are made, and everybody has to be really comfortable with the structures that we put in place. But I think we would say that we have a flat hierarchy, but we have delegated responsibilities within that and accountabilities within that. So we have specific teams that, GPs that are assigned to, clinical governance, for example. We have GPs that are assigned to workforce development, education and training, finance. You can imagine all the different sort of teams that we have, and then they all feed into the partnership. So the partnership, we have 23 partners now, and they, I guess, set strategy and intention and make sure we're upholding our values. And then we have delegated responsibility to look at things from an operational perspective. And it sounds perhaps a bit complex and a bit corporate, but it doesn't feel like that on the ground. And I guess you maybe just have to take my word for that. But it feels like we're all, we're all owners of this concept of this at scale organization, and we feel part of it, and we feel excited to be working in such an organization. And I think not everything's perfect, of course it isn't. This is, there's no such thing probably, but I think we feel like we're starting to deliver something in a sustainable way that actually does have high quality.
Mm. And you kind of mentioned kind of some of the perceptions of at-scale working regarding like a lack of continuity. It sounds like you've kind of been able to avoid that. I think one of the things I often hear is also people get a sense that if they end up working in an at-scale organization, they might lose kind of some autonomy around their professional role. Is there kind of any processes or experiences that you've had in that kind of area?
So I think it is important to have standards, but I think that's true of any organisation wherever you are. And actually increasingly we have our CCGs provide referral criteria. There's standards about how to manage conditions, and that's right. I think that's right and proper. I think what we notice is that not all GPs are the same. We have different skill sets, we have different interests. Yet traditionally, perhaps you'd be deployed in the same way. And I think the at-scale system, and we're just starting to develop this actually, the at-scale situation allows you perhaps to focus on where your interests lie. If you've got a special interest, that can be developed. If you're more comfortable in the urgent care arena, so be it. If you feel more comfortable managing routine conditions or mental health, or women's health or men's health, we can develop that. And I think there are certain benefits to that. And people talk about, well, do you get de-skilled? I don't think so, because you've still got the opportunity to do, to dip in and dip out and be part of that. But it allows us to develop people's interests in a way that enthuses them, and allows them to be happy in their work, positive in their work, and then with that comes sustainability.
I think that's a really interesting reflection. We know that lots of GPs are more and more interested in being able to develop special interests or have that portfolio career. And often people might feel they have to go outside of their kind of home general practice that they work in to be able to realize some of that. But it sounds like potentially you're working in a way that could mean that people can have a portfolio career under one roof, basically.
Yeah, I think that's right. I mean, I do vasectomies in the practice. We have colleagues who specialize in women's health and contraception. We have people who've had dermatologists. We've had mental health specialists within the practice. And actually what we have is an ability to respond to the wishes of those people in the organization. If someone who does have a particular interest, then it can be developed. And of course, it's not always clinical interests. You have people who have interested in the business aspect, in leadership, in education and training, and that can be accommodated too. One of the real positives is that we have become a workforce and training hub for our ICS, and that's brought with it all sorts of opportunities for people to develop, not only in GP training, but now training of GP practice nurses, advanced clinical practitioners, physician associates, healthcare assistants, the whole spectrum of different clinical skill sets, and that's been really rewarding, and it has a knock-on effect in terms of how we work.
Mm. So that all sounds really positive, and I think that people who haven't had experience of working in an at-scale organization might have certain preconceptions about it. Would you say that the experience for a salaried GP working in an at-scale organization is different than if you were working in a smaller practice? You've kind of referenced there's more potential opportunities to work in different roles, to have more access to training. Is there any other kind of key differences you think that exist?
Well, it's difficult to know. I don't necessarily want to compare and contrast, because I think all organisations, have their merits, don't they? And this is not about saying, small practices are great. There's room for everything. What I can talk about is how we approach salaried doctors, and I think we try and have a really supportive approach, particularly for those who are immediately post CCT. We have a development program for the first year, which allows them to develop at their own speed. They have a mentor, and their clinic structure can vary, from something that they're completely comfortable with at the beginning, and then over time, when they're ready, they can increase the number of patients they see, increase their decrease their consultation length till they get to the same sort of levels that the rest of the team are. So that supportive environment is absolutely critical to us. We've also started to introduce fellowships. There's all sorts of fellowships emerging at the moment. There's obviously Health Education England have had their fellowship, and NHSE are starting to think about it now. We had some funding from HEE to understand the concept, but now we're developing it and funding it ourselves. And I think that has come with the scale does allow us to do that. But what that means is that we're developing, almost allowing people to have variation in their job from day one. So the fellowships, roughly 50% clinical, extra PDP time, and then time to focus on their development with their so-called fellowship sessions. And that can be in evaluation, research, teaching, it can be leadership, it can be palliative care, for example, it can be any other clinical skill where people want to develop. They're really open-ended and really user defined. So, and that's been really positive. We've now got a team of 11 post-CCT fellows, and I'm really fortunate actually to work with that team and learn from them, and they spark off each other, and it's just such a healthy environment. I think it's such a I feel it's the right way to go. I think that having variation in your career from the outset is something that lends itself to sustainability. We're going to have to be working for a long time, probably nowadays. I think we're looking at 40-year careers, aren't we? And I think having sustainability, variation, special interests, enthusiasm is the way to achieve that.
I mean, as you say, there are, increasing, I think, that support around that important transition from trainee to First5 GP is being recognised in lots of different ways, lots of different fellowship programs, but being able to kind of host that in-house and make it really kind of tailored to the people that are coming through your organisation must be, like you say, quite a really nice thing to be a part of.
Yeah, I think it is. It feels, it's certainly massively increased my job satisfaction to be able to support people to develop. And I think the other element of that is it enables us to offer flexible careers. So we hear, I guess you hear throughout your training the importance of committing to registered lists, offering continuity of care. And I think what we want to try and do is facilitate that, with flexible working, whether that's, term time contracts, or, just basically allowing people, whether they work in the middle of the day, you don't have to work from 8 till 6:30 every day. I think we can be flexible around that, and having the bigger team and the multi-professional team allows us to do that, and very happy to do that. And I think, if we can get young doctors to commit to a registered list, give them the type of quality of care that we know works in general practice, yet at the same time be flexible to their needs within their life, again, that feels like a really good thing to be doing.
Definitely. I think that's going to be a really important part moving forward. And I think that flexibility, particularly over recent months, has come even more to the forefront of people's minds, because they've seen that actually there are the tools and capabilities to be able to facilitate a more flexible approach to work patterns for everybody. And that's kind of a really amazing approach to kind of the First5 experience. Do you think that the trainee experience is any different in your organisation, or is there anything specific that you've done there to target trainees?
Well, I think obviously, the training that you have to go through is fairly well prescribed, isn't it? And so we're absolutely fully supportive of training. We have obviously a number of trainers right across our organisation. I guess what we develop is, we have lots of trainees in the organisation at the same time. So the cohort camaraderie, the shared learning is really good. We do group tutorials, and I think, that is a benefit that perhaps you wouldn't get if you were a trainee in a smaller practice on your own, for example. You wouldn't have that. Now, I'm sure there are pros and cons to both, and I'm not comparing and contrasting again, but I guess that's one of the potential benefits of being in an at-scale practice, is that you have colleagues alongside you in the same boat, perhaps at different stages of training, and you get that learning almost by osmosis, really. You're just learning from people's experiences at different stages. But it feels, I think training is so important, and I think in the areas where I work, in the deprived coastal East Coast areas of Yorkshire, we're seeing the makeup of trainees differ. I talked about this on a recent college webinar, that we're seeing increasing numbers of international medical graduates, and I think the national figures are somewhere around 35 to 40% of new trainees are international medical graduates. In some of the areas where I work, it can be as high as 75%. So having cohorts of international medical graduates in the practice, getting to know each other, building relationships, I think feels important, and we're trying to support that right across the area, really. And I think that's going to be increasingly important moving forward.
Yeah, definitely. I think that's a really important area, and it's again really nice that you can be able to focus on some of those specific needs that international medical graduates might have when they come into GP training. We've spoken a lot about a lot of different benefits of at-scale working, both in terms of kind of benefits for patients, benefits for the workforce. What are some of kind of the key challenges you think for at-scale organisations, whether that's being a partner within them or a member of the wider workforce?
Yeah, I think there's clearly challenges. There always are, aren't there? I think one of the things we found during COVID is trying to standardise approaches across all different organisations, and communication. Distance is a problem. If we take our three places of York, Scarborough, and Hull, it's an hour's drive in between each. So moving things around, moving people around, can be a challenge. We try not to have clinicians working in more than one place, although that is possible and increasingly possible with technology. Yeah, I mean, there are challenges. Communication, standardization, they are difficult, can be difficult. But I think, if you have a good, we have good meeting structures, we have good digital communication structures, and I think we're really aware that we've got to get that right, and therefore you almost overdo it. And I think that's really important. Making sure the staff know each other. I think that's that's a challenge. We do have a whole organisation away day once a year where we try and do that sort of socialisation and bonding and making sure that we're aware of what everybody does in the organisation. That's a big challenge. But I think recognising it is halfway there, really. Well-being can be important. I think we're really trying to focus on that at the minute, and I think the pandemic has probably brought that to the fore. But we're making sure that we're trying to make sure that we consider well-being in everybody's job plan. We've put together a well-being team, and they're comprised of different people from different sites, and just trying to give some importance to it. Make sure people have time to reflect on their own well-being at what is a really difficult time.
So I think that's again, like, really just, I think having the capability to be able to kind of think about some of those issues and work them into people's everyday kind of thoughts around how they approach their work is again a really nice benefit, perhaps, of working at an at-scale organization where there are people who can focus on lots of different areas that might not necessarily get focused on in the same way in smaller organizations. But again, I'm sure there are pros and cons of both approach, but I think it's just a really interesting way to think about the standard model that lots of people think about when they think of how general practice runs.
I think that's right. I think what we've noticed that as you grow, you don't lose staff. We redeploy them. You see, what you create is capacity to do other things or to do more things, and I think that's been, as we've grown over the years, that's been a really important learning point for us about how to develop people, how to understand what is possible, and how to develop people to deliver what is possible. And I think well-being is a classic example of that, whereby we've got staff who can dedicate time to looking at well-being needs of the organisation, do the staff surveys. We have a well-being newsletter. We have a well-being strategy. We're starting to introduce protected time for that, and that's just one example of one of the benefits of at-scale working.
I guess these benefits are being increasingly recognised. I guess part of the impetus behind things like primary care networks is all around that sense of collaboration, getting people to do things more at scale. From your perspective, with someone with a lot of experience working in an at-scale provider, what are some of the things or what would you like to see happen in the future of at-scale general practice? What kind of hopes do you have, not just for your organisation, but for general practice more broadly, working in an at-scale way?
Yeah, so I'm actually very excited about this. I might be, I don't know whether I'm in the minority or not, but I kind of do think this is potentially very exciting, and bringing practices and organisations together to think about how we look after our populations. There are things that will definitely be that are right to keep at that practice level, without a doubt. There are things that we can do at the 50,000 level that PCNs are developing into, but there are things that I think will be best delivered at a system-wide level. So one of the things that I've been able to get involved with because of the leadership time I have is running a GP provider organisation in the city of York. And so we have practices, we have our PCNs, and then all the practices are now involved in the provider organisation. And that's starting to deliver things. Obviously, it delivers improving access, the 6:30 till 8 contract, and it's delivering some enhanced services that we've pooled together from practice level to do at system level. We're looking at delivering, potentially being involved in out of hours again. We're looking at sexual health services across the city, community services, and all the time working in partnership with other stakeholders. So if you've got your whole system GP organisation working alongside the hospital, working alongside local authority, working alongside the community and voluntary sector, mental health services, and together we can create even bigger economies of scale, share staff, share ethos, share objectives. And I'm very excited about the potential there. Clearly, we're not there yet, and there's lots of development to happen, but the building blocks are beginning to fall into place. And I think that's a natural extension of at-scale general practice, where we start to look at population health and work together as a system to address the needs of the population. So yeah, I'm very optimistic about that moving forward, and I think all the bits can coexist: practices, PCNs, and the larger provider So yeah, let's see what happens. But I think it actually was reflected in the RCGP's Future of General Practice paper. That we talked about the importance of technology, and I think that's a whole different conversation. But it's clearly going to be part of our lives moving forward, and a big part of your career just at the outset, and people in your position. We talked about reducing bureaucracy wherever, but we also talked about population management and working with stakeholders. And I think we've seen some examples of that during the pandemic, which is really good to see.
Yeah, definitely. I think if I wasn't already feeling excited about kind of at scale general practice before, I definitely am now, Mike. It's really interesting to hear kind of your personal perspective on the journey that you've been through, some of the benefits that you've been able to realize through working at scale. And I hope that everybody listening to this video goes away kind of with a different take perhaps on what at scale can mean in certain situations.
Thanks, Anthony. It's been a pleasure talking to you.
Thanks a lot, Mike, for your time, and thank you everybody for joining, and we'll see you next time for another RCGP Masterclass.